What are the remedies for reducing irrational fear?
I think the first step would be for a person to try to identify whether a fear is rational or whether it's something that's imaginary. Another helpful piece of advice would be for the person to start to allow himself to feel the feelings that perhaps he's been running away from, so that he should learn to become comfortable with the emotions that he might find uncomfortable, such as hate or anger, at the same time learning to sit with emotions that are perhaps more tender and delicate, such as love or desire. But I think a relationship of trust would really be a very helpful thing as well, if a person who's been suffering from irrational fear and its related problems could actually develop trusting relationships with people, places, and things that are worthy of trust.
It sounds like what you're saying is that professional counseling might be very helpful.
Yes, professional counseling can be very helpful, especially if the counselor that is chosen has a balanced emotional life and actually understands the nature of irrational fears and repression of emotions.
What is the role of education in re-educating for victims of irrational fear?
Well, I think education becomes particularly important in trying to teach a person about the beauty and the goodness of their God-given emotions. I think actually it's important for a person to understand that emotions are fine. There's nothing wrong with your emotions. There's no need to be afraid of emotions. That emotions really are something that can be very useful. They serve a good purpose. They have true value. And in fact, what I usually do with clients is I actually show them something that we call at Hope Family Resources your emotional rainbow. And the emotional rainbow actually lists the 11 different types of emotions, the basic types. Actually, St. Thomas Aquinas wrote about the different emotions, and there are 11, and they're divided into two groups: the humane emotions, which are love, desire, and joy, and their opposites: hate, aversion, and sadness. We also have the utilitarian emotions, and those are comprised of hope, courage, and anger. And their opposites: the opposite of hope is despair, the opposite of courage is fear, although anger does not have an opposite emotion. But I think by explaining to clients the nature of their emotions, they really do benefit in their emotional life. And I think one of the things that you'll find they report to you after they've learned more about their emotions is that they feel that they're actually experiencing a kind of a resurrection in their emotional life. So it's as if they were once in a church that was very dark and they can barely make out the pews and the altar and the stained glass windows, but as their emotions rise from being repressed and buried for so long, they begin to see the colors in the stained glass, the sculptures, the outlines of the altar, and the church really, it becomes a glowing place for them to be, and they begin to notice things that they never noticed before, so their life is more full and abundant. So it's really an awakening.
Are there any other remedies?
Well, I think one of the other things that people can find helpful would be to try to actually increase the amount of heart-moving and heart-warming experiences in their lives. So, for example, they might listen to music which they find particularly moves their heart and softens it. Perhaps they can read poetry, perhaps watching movies that are tragic or very sad. Movies and plays, going to theater that really has emotional impact is also very helpful.
Dr. Mari, we hear so many people that because of their struggle with irrational fears, that they are on various types of medication. What is or what should be the role of medication for persons suffering from such problems?
Well, I think what's important is to think back about our nervous thermometer and look at the different gradations, mild, moderate, severe, and profound, that if a person is finding that their nervous temperature is moving up from moderate to severe and profound, so that they're experiencing panic or obsessions or compulsions or bizarre thoughts, that it would be something that would be so significant in their life to actually disrupt their daily living, and so medications would certainly be prudent to be prescribed by a medical doctor.
And as far as religion, what is the role of religion in all this?
Well, I think it's very important for a person who suffered from irrational fear and emotional repression to actually learn to be still in the presence of God, to learn to meditate prayerfully, to experience the presence of God to the point that the client asks God to actually begin to heal the emotions that have been imbalanced, to actually bring back memories that perhaps were related to the emotions from the past, and the person can ask God to heal those emotions so that they really lead a fuller life, especially a life of the heart.
So God could help with these emotional...
Yes, with emotional problems, especially repressed emotions.
So when we speak of having faith or trust in God, what does faith in God, or how does faith in God enter into this picture?
Well, I think the essence is that perfect love casts out fear. So in developing a relationship with God, it's really important to develop love and trust and surrender to what God is trying to do in your life. And I think the spirituality of St. Teresa, particularly her little way of spiritual childhood, is really the good approach to have in the face of God the Father, to actually allow God to embrace you in your life in a tender way so that your emotions are warmed and tenderized, and your relationship with God becomes one of peace and ease and comfort and trust. So the little way of spiritual childhood really is a way of a person, in some ways, going back to when they were small and they had a certain spontaneity in their emotions, and they had more joy, more of those tender, humane emotions that I was talking about before. So that it's something which is an awakening of the softness of the heart of a child. And I think St. Teresa in her life was someone who actually made love and trust and surrender significant keys in a person's quest for emotional health, that these elements of spiritual childhood are keys to good mental health.
So St. Teresa, when you talk about spiritual childhood, we're not talking about, I know you often hear about in the Bible about not being like a child. Now, that seems to contradict, but you're saying an emotional way that to be like a child, and that relates to faith?
Yes, we're not talking about childish ways that are immature, such as running from your own emotions, which is really a more immature method of handling the emotions, but we're talking actually about embracing the totality of your being. And that's something very mature and something that really gives you a tender, loving heart.
And St. Teresa espoused this way?
Yes, actually, that's really what she was talking about in her little way, that it was a way of trust and confidence that brought a person close to the Father, so that the person actually developed greater love and tenderness to God, the Father.